What I hope to cover is some very high state level data on the health and well-being of children and youth with special health care needs in Tennessee. We're going to spend a little bit of time talking about that. I realize thinking about data is not the most exciting thing on a Saturday morning, so we're just going to sort of dip our toes in the water there. And then we're going to spend some time talking about some public health resources that are available to support all of you as you engage in care coordination in the medical home. And then finally, I want to share some primary care updates that are relevant to pediatricians that are coming from the public health sector, and hopefully some of those will be things that are new to you. So just a little bit about us as the Tennessee Department of Health. We're the state public health agency, and our mission is to protect, promote, and improve the health and prosperity of people in Tennessee. That used to be just improve the health of people in Tennessee. However, we know that health and prosperity are inextricably linked, and so if you're not prosperous, you're less likely to be healthy, and if you're not healthy, you're less likely to be prosperous. So that has been added in to really boost that mission. And our vision is that we are a recognized and trusted leader partnering and engaging to make Tennessee one of the nation's 10 healthiest states. That is very aspirational. If you know where we are now, we currently rank 42 in all the states in terms of overall health and well-being, so we've got a long way to go. If you look at many children's health indicators, we're actually worse than that. Things like infant mortality, we're 47th in the country. So we want to do better, and we need all of your help to do better as we move toward that top 10 designation. When people think of public health, typically they think of things like STD tracking and immunizations, but I just wanted to share with you some of the broad functions that the state health department does. Everything from our division of family health and wellness, which I'll talk about in just a minute, to we have the Office of the Chief Medical Examiner, we have a legal branch. Our legislative folks right now are very involved in working with the General Assembly, looking at all bills related to health. We have the state lab. Some of you are probably familiar with that, as that's the place where newborn screening results are sent, and you get notifications from them when those are abnormal. And then our Community Health Services Division houses all of our 95 county health departments. So wherever you are in Tennessee, you are not far from a local health department. So hopefully through your work yesterday, you were able to engage your care coordinators from Children's Special Services or CSS program. Those folks are accessed through local health departments, and there is one of those near you. Our Division of Family Health and Wellness houses our maternal and child health, chronic disease, and supplemental nutrition programs. We are the state Title V agency. You may not have heard of Title V before. It's Title V of the Social Security Act, and that's what's established at the federal level, the Maternal and Child Health Block Grant. So in Tennessee, we get about $11.5 million every year from the federal government just to focus on maternal and child health initiatives through the public health sector, and that's managed through our division. So the maternal and child health programs are there. Chronic disease includes things like the Tobacco Quit Line, which we'll talk about in just a bit. And then supplemental nutrition is largely our WIC program, or Women, Infants, and Children program. You all probably have patients in your practice who are served on WIC. We cover about half the births in all the state. And so WIC is by far one of our largest programs through public health. And this just gives you an idea of the various programs that are offered through the Division of Family Health and Wellness. Everything from CSS to family planning to home visiting to newborn screening, lead poisoning prevention and follow-up, just to name a few. So I want to cover briefly some state-level data on children and youth with special health care needs, and just start out with a couple of acronyms. You may have seen them already in this summit, but if not, just to make sure we're all on the same page. So when we say CYSHCN, we're talking about children with special health care needs. Typically, we will say CYSHCN for children and youth with special health care needs to really recognize that there's the spectrum through adolescence and into early adulthood where we want to be involved with care coordination and transition. And if you think about what does that mean, children and youth with special health care needs, the way that the Academy and the Maternal and Child Health Bureau at the federal level define that is those who have or are at increased risk of having a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. So it's a very broad definition of children and youth with special health care needs. Sometimes we let our minds jump to the kids who have a very obvious condition or disability, when in fact it also includes those kids who are at risk. And so thinking about how we provide services in that space so they don't end up in the category of kids who do have a condition and need extra services. Want to share with you a data resource. A lot of the data that I'm going to cite comes from this, but this is a great resource for you as you go back to your practices and you think about how do you benchmark what you're doing with national standards. So there's the National Survey of Children with Special Healthcare Needs, and what that gives you is both national and state level data about a core set of indicators related to health and well-being for kids with special health care needs. This is what the website looks like. The link is on the previous slide. I think you all will have access to those slides, and so you can click on that and visit. You can get, again, national level information or state level information about the topics that you're interested in. So a lot of this comes from that website, just to give you an idea of what's there. If you take that broad definition of children and youth with special health care needs and apply that to our population, so we have about 6.5 million people who live in Tennessee, about 1.5 million of those are children under 18. And if you say how many of those have special health care needs, it's about 250,000 of those children who have special health care needs. That's a lot, especially if you think about children who are known to us through programs for kids with special health care needs. Very few of those programs have roles that approach 250,000. So it leaves us some great opportunity for outreach. That's almost 1 in 5 children in the state with special health care needs. And again, you think about that broad definition, that starts to make sense. You can see there the prevalence by age as well as by sex. And then if you think about poverty level, one of the things I want to highlight here is that this notion of having a child with special health care needs really transcends poverty. Certainly kids who live below the federal poverty level are at increased risk of being in that category, but there are certainly kids who are from more affluent families as well. And you can see there are some slight racial differences and ethnic differences if we think about the prevalence of special health care needs among Tennessee children. What we really want to think about is how does this impact their health and well-being? And we always like to ask the question, so what? So you have this designation, what does it mean? So when a child has a special health care need, and we ask their families about particular aspects of that care, almost 28% of them report that that health condition affects their activities either usually, always, or a great deal. So these impact their lives. Almost 1 in 6 of them had 11 or more days of school absences due to illnesses. And why is that significant? We know when kids aren't in school, if they're out of school a lot, they're not going to perform as well throughout the rest of that time. We also know that means a caregiver is probably out with them. So if you think about the economic impact on that family, it is often extreme. Regarding health insurance, not very many, only about 5% of these families who were surveyed were without insurance at some point in the past year, but a vast number of them, almost a quarter, reported that the insurance they had was inadequate. So again, you have insurance, but is it meeting all your needs? And I think that's a great opportunity to think about programs like CSS that you heard yesterday that can fill in some of those gaps. We also know that just having insurance is not enough. So if you think about access to care, for this survey, 18% of these families reported that they had an unmet need for specific healthcare services. A number of them had difficulties getting referrals, and a handful of them also did not have a usual source of care. And so I think as we think about the primary care medical home and as we think about how do you define that, usual source of care works its way in there. And so as we think about making those more available and making sure every child has a medical home, we would expect to see that improve. We also know that family-centered care is a really important part of the primary care medical home, keeping families involved in decision-making and partnering with them on improving their child's health. And about 1/3 of our families in Tennessee who have kids with special health care needs say that they don't receive family-centered care. So some great opportunity for us there as well. And if we think about why it's important to involve the family, we know that families who have kids with special health care needs are impacted by those medical conditions. So about 1 in 5 of those families surveyed paid $1,000 or more out of pocket per year for their child's medical expenses. A similar number had financial problems because of the child's medical condition. And many of these families report they spend a lot of time working around that child's medical condition on care coordination or actually providing health care. And many of these families actually have to stop working because it becomes a second job for them taking care of these kids. And so certainly a major impact on their family health and well-being, not just their child's health. Some good news, maybe. So if you look at our outcomes compared to other states, so Tennessee is reflected here in the orange bars. I'm not a native Tennessean, but I learned that orange is an important color here. So Orange is what's shown there for Tennessee. The national numbers are shown there in blue, and for most of these core outcomes related to kids with special health care needs, we do better than the national average. But I would argue that if you look at the national average, it's not that great. It's kind of like we are 42nd in the country, but our country overall is 37th in the world for health and well-being. So even if we get to the top 10, we're top 10 in a country that's number 37. We got some work to do. So I don't think it's good enough to say we're better than the national average, because the national average isn't that great. So a lot of opportunity for us to think and work on behalf of these families. So that hopefully sets the stage as we think about the need in this state and sort of the current state of health and well-being. What I want to talk about next are some public health resources that can support the work that you're doing to address some of those outcomes we just talked about and the everyday work that you do in the primary care medical home. The first is our Children's Special Services Program, and I'm just going to talk briefly on this because our State Director, Jackie Johnson, is going to talk to you next in detail about this program. But this is available in all 95 counties, again, accessed through your local health departments. And we serve kids and families through this program who are below 200% of the federal poverty level and who have a diagnosis of a chronic physical condition. You'll hear from Jackie, that list is very broad, and so the vast majority of these chronic physical diagnoses we can cover. And that program has really two important components. One is a care coordination component, and so I know we had some care coordinators here yesterday that you got to meet who will work with you, work with those families to help address some of those needs they have, do things like make referrals to subspecialists, arrange transportation, arrange care, and that sort of thing. But the other piece of CSS that we don't always think about is that we are a payer of last resort. We know that there are very few kids in Tennessee who don't have health insurance, so this is not always a huge issue, but for some families it is. And so if they've exhausted all other means of payment for a particular health care service, or they don't have insurance at all and are uninsurable, CSS can actually be a payer. And Jackie's going to tell you about some of the things that we can pay for through that program. Our CSS program more broadly sits in a group that we have reorganized recently around children and youth with special health care needs. In that group, we have our D70 grant, which is funding this medical home summit and the work that Deanna and Becky are doing around improving care coordination in the medical home. And we're starting to look more broadly. For a long time, we just look at our CSS program as we think about kids with special health care needs, but we're looking more broadly and where there are gaps and opportunities to address that. I mentioned earlier newborn screening. That program is an important public health program for pediatricians. So you all are probably very well aware that the state law requires that every baby born in this state not only receive the dried blood spot that comes to us for metabolic screening, but now that they also get a hearing screening and a pulse oximetry screening for critical congenital heart disease. We have about 80,000 babies born every year in this state. About 3,000 of those will have some abnormality on their newborn screen that requires some sort of follow-up. So our nursing team in our office takes care of that. And each one of those little blood spots, and you can see here an example of a blood spot card, each of those blood spots that's drawn from a particular child is screened for 51 different conditions. It's a great model. Hospitals pay about $75 for that test. It's usually bundled as part of the newborn charges, and then those children are screened for those 51 different conditions. If there is an abnormality on that screen, we have follow-up nurses in our office who perform case management. They will talk to our regional genetics centers or endocrine centers or whichever specialty center is appropriate depending on the potential abnormality, and then communicate with the primary care office to say we need to get this child back in, or we need this particular test repeated in order to see what's going on. We also have childhood lead poisoning case management. So one thing I didn't know actually until I joined the department was that all blood lead levels are reportable to the State Department of Health. At that time the cutoff was 10, and so I thought, well, we just report cases that are 10 and over, but in fact the rule requires that all blood lead levels are reportable. If you send your lead levels out to a commercial lab, they automatically report them all, but we know that more and more providers are having the point of care testing in their office, and so when that occurs, even if it's a result that is below the threshold, which has now been lowered to 5, those are required to be reported. When you order a blood lead level, you're responsible for following that up, but we have follow-up nurses who can assist in that. You've probably gotten reminders from them, either a fax or a phone call saying, you know, your patient had a blood lead level that was elevated. We're not seeing a follow-up test. We just want to make sure that that's getting done. So our role there is really to work with the primary care providers and make sure those kids are getting back in for those follow-ups. In the event that it's extremely elevated, or sometimes you have cases that aren't extremely elevated, but they're just persistently elevated, you want to think about an environmental investigation. Our office can help support that. And routinely when we send folks out, they do a lot of specialized testing to look for sources of lead that aren't that obvious. And usually they will find some, and we can share that information back with you and the family to try to avoid those exposures. We also have home visiting programs. When I was in practice, I always thought about home visiting as a really nice adjunct. Home visitors were the eyes and ears that could see kids and families when I couldn't, and could follow up on them and let me know about concerns. We have programs, home visiting programs, in most of our at-risk counties across the state, and those professionals will meet with the family. Sometimes it's once a week, it may be every couple of weeks, or once a month, depending on that particular family's needs. And they do a number of things. They look at child development to see how is that child doing from a child development standpoint. Do we need to make referrals? How can we support the parents? So they provide education on health topics and positive parenting. And then they also connect the families with community resources based on their specific needs. We also have our HUGS program. So HUGS is Targeted Case Management. This is available in all 95 counties, so regardless of where you are in Tennessee, this is available. It's for our families who are eligible for TennCare. And in this program, a case manager visits families once a month. They assess their development using the periodicity schedule that we in the world of pediatrics use. They actually use the Ages and Stages developmental screen. They've all been trained on that, how to perform that, and then how to refer back to the primary care medical home and to TEIS if there's an abnormality. They always try to connect the families back with the medical home. We are absolutely not trying to replace the medical home. We don't have the resources to do that. So we check back with them to make sure they know who their primary care provider is. Are they getting their well child checkups? Are they getting their immunizations? What are the issues that might be impacting them from doing that? And then, as always, we refer them to community resources. So I want to close by just sharing some updates that I think will be beneficial to you and the kids and families that you take care of. Some of these you may have heard of, and again, some of them may be new. The first is a program called Welcome Baby. We started this within the last year, and it's a universal outreach program to all new parents. So for those 80,000 births every year, every one of those families now gets a package. It's got a cover letter that's signed by our First Lady, Chrissy Haslam. You can see a screenshot of the letter there that basically says, congratulations, we're so excited for you. We know that parenting can be hard, and there are some resources, and here are some resources that can help. So we link them back to Kids Central TN, which is a website I'm going to tell you about in just a minute. We include some information in there about safe sleep and information about the Books from Birth program, things for families to get that healthy start and connect with community resources. So that's for all births. All 80,000 will now get that packet. Based on their birth certificate, we have looked at birth certificates and matched them with death certificates, and looked at, for babies who die in that first year of life, what are risk factors that we see on the birth certificate that make that baby at higher risk for dying. And we know there are some things that are very obvious. If you see on the birth certificate, we'll say, gosh, this kid is at increased risk of not living to their first birthday. So when we get those birth certificates, we divide those families into low, medium, and high risk. If they're low, they've already gotten the welcome packet, and so there's nothing else that happens. But if they're medium risk, they actually get an outreach phone call from our nursing center, and a nurse reviews some basic child safety and educational messages for them, finds out if there are any needs, particularly related to health care, connects them with community resources. And then for the highest risk families, they actually do an outreach home visit. Now, of course, all these are voluntary. We can't force our way into any family's home, but we offer that visit as an adjunctive resource to those families who are most in need. When we actually go out and do those home visits, we tend to take them some incentive items. So you can see here these Safe Sleep onesies, this diaper bag that we can take them. Families often are very appreciative of those resources and open to having a visit when we bring those kinds of items. So that program has started just within the last year. It started October 1st, and so we're really excited to complete a full year of that and look at the impact on those connections with community resources. We also have our Safe Sleep campaign. Hopefully this is not new to anybody in this room. If you don't have a Safe Sleep button like this, I think we gave them all out yesterday, but we can get you some more if you want. We started this a couple of years ago because we recognized that sleep-related infant deaths are a major driver of infant mortality in our state. So infant mortality is that measure of babies who don't live to see their first birthday. Every year in Tennessee, we have in the range of 580 to 600 babies who don't live to see their first birthday. That's a lot. That's about 7 out of every 1,000 that are born in this state. And what we know from a very thorough review of all those deaths is that 20% of all those deaths, 1 in 5, are due to unsafe sleeping conditions. Those are entirely preventable. And I talked about rankings earlier. If you think about our ranking for infant mortality, we're 47, so very close to the bottom in the country. If we could take out those 120 sleep-related deaths that occurred last year, we would catapult to number 25. We would be at the national average for infant mortality just by addressing sleep-related deaths. And this is an opportunity I think pediatricians have a great role to impact this particular health indicator. You talk about how babies should sleep when you see them, both rounding in the newborn nursery and when you see them for those first few child visits. So we have focused on the very simple message of ABC. Babies should sleep alone, on their back, and in a crib. Those messages align exactly with the AAP's latest policy recommendation around safe sleep, with the body of scientific evidence around safe sleep. And so we really need everybody sort of singing from the same book on this one and sharing those messages. We have these materials available, so this is a poster. We've got a flyer that's got a little bit more detailed information if you've got an opportunity to have a little bit more time to talk with the family. We've got these door hangers. These are great. You can give to the families and they put them in the room where the child is sleeping. We also tell people to take several so they can put one in the diaper bag, so if baby's going to grandma's or baby's going to another caregiver's. Those folks usually aren't at the well child visits. They don't get to hear those messages from the pediatricians and family physicians who talk about safe sleep, and so it's important for them to hear it as well. This is a great way to share that message. And then we've got these buttons. Would love to have one on all your staff members in your offices, and we've got plenty of these. So let us know if you need any of these materials. They are printed both in English and Spanish, and we're happy to make as many of those available as you need for your practice or if you're doing any kind of community events, and they're completely free. Just let us know and we'll ship them out to you. We've also recently started a hospital safe sleep project. We know that families pay attention to what they see healthcare providers do. And there's great evidence if you look in the literature that even though doctors and nurses know about the safe sleep recommendations, we don't always model that kind of safe sleep behavior for our patients. And so in Tennessee, almost 99% of all of our births happen in hospitals. We have very few births that are born outside of hospital settings. So we thought as we're trying to work on this, we want to think about how we could get those families while they're in the hospital, give them that safe sleep message so before they ever take that baby home and put them down to bed, they're doing it the correct way. And so we launched this Safe Sleep project back in January. Up in the upper left-hand corner, you see this image. This is actually a board book called Sleep Baby Safe and Snug. Really, really cool. It's like any other infant board book, the heavy, thick pages, the kind of sing-songy language, bright and colorful pictures. But it's all about safe sleep. And so you get this great health education message, really without even recognizing that you're getting it. It's kind of like Goodnight Moon. You read it, it's that same kind of language, but it's all about safe sleep. And so we bought 85,000 of these last year, and we said we want those to be able to put in the hands of every family that has a new baby in Tennessee. But we also sort of wanted to provide a kind of carrot and stick situation. So we told the hospitals, we will give you enough of these for all of your births if you will develop a safe sleep policy, if you'll train your staff, and if you'll model their compliance. So we had all birthing hospitals in the state sign up to participate in this. So hopefully the hospitals that you admit to and attend in for newborn nursery are working on this. And about 2/3 of them have already developed their safe sleep policy. Those policies align with the latest clinical report from the AAP. So it's good stuff. It's valid scientific information on which they're basing their policies. And we hope this is going to prevent those infant deaths. So those hospitals, once they do that, they get enough of these board books for all their births. They can get our safe sleep materials if they ask. We list them all on our website. They get a signed certificate from our commissioner and then a press release for their local paper. So I'm excited about that. Appreciate TNAP endorsing that project and being involved with that as we rolled it out, and really hope that's going to have an impact on our infant deaths. The other thing I want to share with you, and this may be new to some of you, it's really, really exciting for us, and this is the launch of our Tennessee Breastfeeding Hotline. When I came to the department 3 years ago, was very interested in breastfeeding and said, what are we doing around breastfeeding? And so I heard about all the things that are going on through WIC, and they said, and we have a hotline. And I said, well, tell me about that. And they started describing it, and they said, and it's open from 8:30 to 4, Monday through Friday. And I said, well, that's great for 8:30 through 4, Monday through Friday. But what about nights and weekends when moms have questions about breastfeeding or providing providers have questions about breastfeeding, what resources there? And at the time, we didn't have one. And so we have just launched, as of January, a statewide breastfeeding hotline. It's available 24/7 to anyone across the state. And mothers can call, but providers can call as well. I remember as a resident carrying the mommy pager and sort of answering those calls in the middle of the night, and the call I dreaded most was a breastfeeding call, because I could talk all day about the science of breastfeeding and the immunoglobulins that were transferred through breast milk, but if mom wanted to know something about how do I get a better latch, or how do I handle some of these mechanics, she was not in good luck when I answered her page that night. And so this hotline is a great resource for all of us, for providers as well. And so the number for that is 855-4BF Moms, like breastfeeding moms. We're actually working on some promotional materials right now, things like magnets that will be available not only in the birthing hospitals, but if you want to give those out to your families so that they can have those, and encourage them to reach out and use that number. We know that we've got a lot of opportunity if we think about improving breastfeeding rates across the state. We also have the Tobacco Quit line, and this has been around for a while, but I find everywhere I go and talk about it, there are still folks who don't know about the Tennessee Tobacco Quit line. So if you look at our population as a whole, about a quarter of all adults smoke in our state. So it is no surprise that a lot of our kids are exposed to secondhand and third-hand smoke. What's also startling is that 16% of our pregnant women smoke. That's a statewide average. If anybody here is from Northeast Tennessee, in some of our counties we have as many as 42% of our pregnant women who smoke, particularly in that part of the state. We know what smoking during pregnancy does to our babies, and if we think about our infant mortality rate and how low birth weight and prematurity contribute to that, addressing smoking can go a long way to helping us move that needle. So the Tobacco Quit line is a great resource if you encounter family members who are smoking, if you've got older youth, adolescents who are smoking. It's a great resource. It's, again, a telephone-based service. The number is 1-800-QUIT-NOW. The cool thing about this is that most states have these, so if your families move, they can still call the 1-800-QUIT-NOW. It's kind of like the Poison Control Center. It will route them to whatever quit line is closest to them. But when the callers call, it is confidential for them. They can get free information, or they can sign up for a Quit Coach, and that Quit Coach will work with them for up for a year. Free of charge, and it's basically a motivational interviewing program where they work for them, and the success rates for quitting are pretty good for folks who stay with it. So we'd encourage you to make sure that your families know about that. We've got some little pocket cards that are business card size that have this information on it, English on one side, Spanish on the other. So if you'd like some of those, let me know, and again, we can get those to you for free. I know that all of you at some point or another get newborn screening results for your brand new babies. Typically those have come either by fax or by mail, or you have to call our number and either talk to a live person, or you can talk through an automated system that will get you those answers. We have recently created an online portal so that you can access those results 24/7. When you do that, you actually get the same image that you get when you get the report faxed by that comes through fax or that's sent by the mail. So you can see an image of what that looks like there. Is anybody in here using that already and signed up for it? So a handful of folks. So we'd encourage you to do that. We did have some cards. I didn't see any on the table, so they may have all been taken yesterday. We can get you some more, though, with information about how to sign up for this service so that you can access these results, and that will save you a phone call or some extra effort. We also have a brand new portal that I want to tell you about, and this was created by the Children's Cabinet. So both the Governor and First Lady chair our Children's Cabinet in Tennessee, and then all the child and family serving agencies work together on that cabinet group. And one of the things they recognized was that it can be very challenging for families to find information about state services. The state websites are not very pretty. If you go to them, it can be difficult to find information. And as we have more and more folks who turn to the web for their information, how do we make that more readily available for them? And so Kids Central TN is the result of that sort of thinking and work. It includes an online directory of state services, and I'll show you a screenshot in just a minute, but you can go in and type in your zip code, and you can type in your zip code and put in WIC, and it will show you where the nearest WIC service is related to that. Or if you want DHS or TennCare, it's going to show you where the nearest places that you can access those services are. In addition, there's a lot of information about child health and development and education. So, pick a topic. You want to know about about immunizations or you want to know about breastfeeding, you can go there and find good information that has been vetted and put online. There's also a new function that parents can go in and actually create a profile for their child, and you put in your child's birth date, and it actually tells you what developmental milestones they should be reaching, the kinds of things they should be doing, things you should be thinking about. That again is a resource to help families think about what is typical development. They've also recently come out with a mobile app, and you can see down here in the lower right-hand corner, so that families can access that profile function from anywhere. And I think one of the really cool features about that is something they call the refrigerator magnet. It's actually part of the app, but it replaces, if you think about back in the day when people used to write for the babysitter on the refrigerator, the doctor's phone number, their phone number, any allergies or information, that information now is sort of kept on a virtual magnet. Families can put in that information, and so if the babysitter's coming over, or the kids going to grandma's, they can actually text that over to that other caregiver, and so they get that emergency information, so they'll have it. And the families can customize that in any way they want. There may be special routines that child needs. They can put all that in there and transfer that over to that caregiver. And again, that's all free. This is just a screenshot of what the Kids Central website looks like. You can click on this part here for Find TN State Services to access that state directory. If you just want to go and learn about a topic, say immunizations, you could come here and type in immunizations, and it's going to bring back that relevant information. So this looks a lot prettier and a lot slicker than most of our state government websites. Actually brought in outside folks to create this, and so it's getting a lot of traffic from parents of children, particularly parents of kids from birth to 5. So really excited about that. The website for that is kidscentraltn, all one word, .com. And with that, I will stop and entertain any questions you have. Want to make sure that you have our contact information. Our office is absolutely here to support the work that you're doing. So if you need materials, if you need resources, please don't hesitate to reach out and let us know. You can email me at the email shown there, or you can call me. Also want to share the very last slide, and this should be in your packet, is instructions on finding your local health department. Hopefully you all know where your local health department is and have that kind of interaction. But if you go to the link here, you'll get a map of the state. And if you click on any county, so if I am in Athens, Tennessee, and I don't see Iris here, we recently went down and visited Iris Snyder, who's one of my favorite pediatricians, and visited with her. But if you click on McMinn County, and you get this pop-up, and it tells you where the health department is, what the phone number is, and how you access that. And so there's also a drop-down list of the counties that you can see there as you think about finding your local health department. But I'd encourage you to think about them as a resource and think about how they can work with you to support the work that you're doing for kids and families.